Chapter 3 Health, the Ultimate Treasure. Question Answers from Grade 8, Subject Science, Book Curiosity. Probe and Ponder. Question 1. How does your body respond to an infection such as common cold? Answer. The body's immune system identifies the virus causing cold. It responds by producing antibodies and activating white blood cells. Symptoms like runny nose, sneezing, fever, and tiredness are signs that the body is fighting the infection. Usually, the immune system clears the infection in a few days. Question 2. We rarely see cases of smallpox or polio these days, but diseases like diabetes and heart problems are more common. Why? Answer. Smallpox and polio have been controlled through mass vaccination programs. Diabetes and heart diseases are non-communicable diseases caused by lifestyle factors like unhealthy diet, lack of exercise, stress, and smoking. Modern lifestyle has reduced physical activity and increased unhealthy habits, making such diseases more common. Question 3. Could climate change lead to a new type of diseases? Answer. Yes. Climate change affects temperature, rainfall, and ecosystems, which can change the pattern of diseases. Warmer climates allow mosquitoes to spread diseases like malaria, dengue, chikungunya to new areas. Floods and waterlogging increase waterborne diseases like cholera. Air pollution and heat waves worsen respiratory and heart problems. Question 4. How do emotions like stress or worry affect us and make us sick? Answer. Stress and worry weaken the immune system, reducing the body's ability to fight infections. They may cause headaches, stomach problems, high blood pressure, and even affect sleep. Prolonged stress can lead to anxiety, depression, and make people more vulnerable to diseases. Question 5. Why do some groups of people get affected more than others during disease outbreaks? Answer. Factors include poor nutrition, weaker immunity, lack of clean water, sanitation or healthcare facilities, overcrowded living conditions, faster spread, economic inequality, some cannot afford treatment or vaccination. Example, during cholera or dengue outbreaks, poorer communities are often affected more. Next, keep the curiosity alive. Question 1. Group the diseases shown in the images as communicable or non-communicable. Answer. Communicable diseases, cold and flu, typhoid, chickenpox. Non-communicable diseases, diabetes, asthma. Question 2. Diseases can be broadly grouped into communicable and non-communicable diseases. From the options given below, identify the non-communicable diseases. First, typhoid, second, asthma, third, diabetes, fourth, measles. Answer. Non-communicable diseases are second, asthma, and third, diabetes. So, correct option B, second and third. Question 3. There is a flu outbreak in your school. Several classmates are absent, while some are still coming to school coughing and sneezing. First, what immediate actions should the school take to prevent further spread? Answer. Immediate actions the school should take: ask sick students to stay at home until recovery, ensure classrooms and common areas are well ventilated and regularly cleaned, make students wash hands frequently and use hand sanitizers, conduct awareness sessions about flu prevention. Second, if your classmate who shares the bench with you starts showing symptoms of the flu, how can you respond in a considerate way without being rude or hurtful? Answer. How to respond to a classmate with symptoms politely. Kindly suggest they inform the teacher or visit the school nurse. Offer tissues or a mask if possible. Be considerate and avoid making fun of them. Third, how can you protect yourself and others from getting infected in this situation? Answer. How to protect yourself and others? Wear a mask in crowded classrooms. Wash hands regularly with soap. Avoid close contact like sharing food, bottles or stationery. Maintain good personal hygiene and boost immunity with healthy food and rest. Question 4. Your family is planning to travel to another city where malaria is prevalent. First, what precautions should you take before, during and after the trip? Answer. Precautions before, during and after the trip. Before, take medical advice and, if recommended, preventive medicines. Pack mosquito repellents and nets. During, wear long sleeved clothes, use mosquito repellents, sleep under nets, and avoid areas with stagnant water. After, watch for symptoms like fever, chills, and sweating. Consult a doctor immediately if symptoms appear. Second, how can you explain the importance of mosquito nets or repellents to your sibling? Answer. Explaining importance of mosquito nets, repellents to sibling. Tell them mosquitoes spread malaria by biting. Nets and repellents act as a protective shield, preventing bites. It is safer to prevent mosquito bites than to suffer from a serious illness. Third, what could happen if travelers ignore health advisories in such areas? Answer. Increased risk of catching malaria, severe illness, prolonged treatment, and possible complications. Spread of disease to others when they return home. Question 5. Your uncle has started smoking just to fit in with his friends. Even though it is well known that smoking can seriously harm health and even cause death. First, what would you say to him to make him stop without being rude? Answer. Politely explain that smoking damages the lungs, causes cancer and heart disease. Tell him there are healthier ways to make friends like sports or hobbies. Remind him that his family cares about his health. Second, what would you do if your friend offers you a cigarette at a party? Answer. Refuse politely but firmly. No thanks, I don't want to harm my health. Suggest doing something else enjoyable instead. Stay confident and do not give in to peer pressure. Third, how can schools help prevent students from indulging in such harmful habits? Answer. Organize awareness campaigns about the dangers of smoking. Invite doctors, experts to talk about harmful effects of tobacco. Encourage healthy lifestyle activities like sports, yoga, debates. Provide counseling for students under peer pressure. Question 6. Sania claims to her friend Vinita that antibiotics can cure any infection, so we don't need to worry about diseases. What questions can Vinita ask her to help Sania understand that her statement is incorrect? Answer. Possible questions Vinita can ask her: do antibiotics work against viruses like flu, cold or chickenpox? Have you heard that antibiotics only kill bacteria, not viruses or worms? Do you know that overuse of antibiotics causes antibiotic resistance, making some bacteria stronger and harder to kill? If antibiotics worked for every infection, why do doctors still recommend vaccines and preventive measures? Question 7. The following table contains information about the number of dengue cases reported in a hospital over a period of 1 year. Make a bar graph of the number of cases on the y-axis and the month on the x-axis. Critically analyze your findings and answer the following. So friends, here's the bar graph. On the x-axis, we have months. On the y-axis, we have number of dengue cases. So friends, you can make it. So take the gap of 10, 10, 20, 30, 40, 50, 60. And on the x-axis, January, February, March, April, May, June, July, August, September, October, November, December. So in January we have 10 dengue cases. So we have made the bar graph here. In February we have 12. So we made it here. In March we have 15. So we have made it in the middle between 10 and 20, 15. In April we have 18. In May we have 22. In June we have 40. In July we have 65, In August, we have also 65. In September, 65. So these three bars are equal in height. Then in October, 30. In November, 30. And in December, 20. So friends, in this way you can make a bar graph on a graph paper or on a simple paper. Now let's move forward. First, in which 3 months were the dengue cases highest? Answer: July, August and September, 65 cases each. So friends, in July, August and September. Second, in which months were the cases lowest? Answer: January, 10 cases. So friends, here in January we have least number of cases, that is 10. Third, what natural or environmental factors during the peak months might contribute to the increase in dengue cases? Answer: monsoon season leads to water logging and stagnant water. Mosquitoes breed in stagnant water, increasing their population. Warm and humid weather supports mosquito survival. So friends, we know July, August, September is the monsoon season. That's why the peak months might contribute to the increase in dengue cases. Fourth, suggest a few preventive steps that the community or government can take before the peak season to reduce the spread of dengue. Answer: eliminate stagnant water from drains, coolers, pots and tires. Spray insecticides in mosquito prone areas. Promote awareness campaigns about dengue prevention. Encourage people to use mosquito nets, repellents and wear full sleeved clothes. Regular monitoring and early warning systems for dengue prone areas. So friends, these are the preventive steps. You can note it down. Question 8. Imagine you are in charge of a school health campaign. What key messages would you use to reduce communicable and non-communicable diseases? Answer: key messages for reducing communicable diseases: wash hands regularly with soap and water. Always drink clean and safe water. Keep surroundings clean to avoid mosquito breeding. Cover mouth and nose while coughing or sneezing. Get vaccinated on time. Key messages for reducing non-communicable diseases: eat a balanced diet with more fruits and vegetables. Avoid junk food, excessive sugar and oily food. Exercise daily, play outdoor games and do yoga. Get enough sleep and manage stress. Say no to smoking, alcohol and drugs. Question 9. It is recommended that we should not take an antibiotic for a viral infection like a cold, a cough or flu. Can you provide the possible reason for this recommendation? Answer: antibiotics only work against bacteria, not viruses. Cold, cough and flu are caused by viruses, so antibiotics are ineffective. Taking antibiotics unnecessarily can kill helpful bacteria in our body. Overuse of antibiotics leads to antibiotic resistance, making bacteria stronger and harder to kill in the future. Question 10. Which diseases among the following may spread if drinking water gets contaminated by the excreta from an infected person? Answer: hepatitis A spreads through contaminated water. Poliomyelitis, polio, spreads through contaminated water. Cholera spreads through contaminated water. So correct disease is hepatitis A, poliomyelitis, cholera. Question 11. When our body encounters a pathogen for the first time, the immune response is generally low, but on exposure to the same pathogen again, the immune response by the body is much more compared to the first exposure. Why is it so? Answer: when the body faces a pathogen for the first time, the immune system takes time to recognize and produce specific antibodies. Hence, the response is slow and weak. During this first attack, the immune system also develops memory cells. When the same pathogen enters again, memory cells quickly recognize it and produces antibodies rapidly. This leads to a faster, stronger and more effective immune response. This principle is also used in vaccination. Next, discover, design and debate. Question 1. Students maintain a health diary for at least a month to track food, hygiene, exercise, sleep, screen time, and emotional state. Students should maintain a health diary for at least 1 month recording food, what they eat daily, balanced diet versus junk food, hygiene, bathing, brushing teeth, washing hands, nail cutting, exercise, outdoor games, yoga, walking or physical activity, sleep, number of hours slept each night, screen time, hours spent on TV, phone or computer, emotional state, feelings of happiness, stress or loneliness, outcome. Students learn about their lifestyle and can identify unhealthy habits that need improvement. Question 2. Read about Indian scientists like Suniti Solomon, Asima Chatterjee, Dr. Yella Pragada Subbarao, Dr. Mary Poonan Lucas for their contributions in the field of health and diseases. Answer. Dr. Suniti Solomon, first to identify HIV/AIDS cases in India, worked to spread awareness and reduce stigma. Next, Asima Chatterjee, famous for research on medicinal chemistry, developed anti-malarial and anti-cancer drugs from plants. Next, Dr. Yella Pragada Subbarao discovered important antibiotics, aureomycin tetracycline, and developed cancer drugs, contributed to nutrition studies. Dr. Mary Poonan Lucas, first woman surgeon in India, worked on maternal and child health. Outcome. Students understand India's significant contribution to medicine and public health. Question 3. The deadly disease smallpox was eradicated by vaccination. Discover how this was done and why it worked. Debate whether everyone should be required to get vaccinated to protect others. Answer. Smallpox eradication and vaccination debate. How smallpox was eradicated. Edward Jenner developed the first vaccine using cowpox virus. WHO launched global vaccination campaigns. By 1979, smallpox was completely eradicated worldwide. Why it worked? Smallpox had no animal carriers, only spread among humans. Vaccination provided lifelong immunity. Global cooperation and mass immunization ensured success. Debate. Should everyone be required to get vaccinated? For. Vaccination prevents deadly diseases, protects the community, herd immunity, and saves lives. Against. Some argue about personal freedom, vaccine hesitancy, or side effects. Conclusion. Vaccination is safe, effective, and essential for protecting both individuals and society. Question 4. According to current guidelines, learn the correct sequence of steps for performing cardiopulmonary resuscitation (CPR) on an adult in case of sudden stoppage of breathing. School may invite a doctor or a professional to demonstrate a mock drill. Correct steps of CPR, cardiopulmonary resuscitation. For an adult with sudden stoppage of breathing, first, check the patient's response and breathing. Second, call for help, ambulance immediately. Third, place the person on a flat surface. Fourth, begin chest compressions. Push hard and fast at the center of the chest. Rate about 100 to 120 compressions per minute. Depth about 5 cm. Fifth, give rescue breaths if trained. Tilt the head, lift the chin and give 2 breaths after 30 compressions. Sixth, continue 30 compressions plus 2 breaths cycle until medical help arrives. Schools may invite a doctor to demonstrate a CPR mock drill. Question 5. Invite a doctor to the school. Students may be encouraged to interact with the doctor on the issues of malnutrition, undernutrition and overnutrition. Interaction with a doctor on nutrition. Topics for discussion: malnutrition, lack of adequate nutrients, undernutrition, insufficient food intake weakens stunted growth, overnutrition, excess food intake, obesity, diabetes, heart disease, ways to maintain a balanced diet and healthy eating habits. So friends, you can discuss these points with the doctor. Question 6. If you are given an opportunity to create a health card, what all would you like to include in it? Create your own health card and have discussion about it. Answer. A health card may include name, age, blood group, vaccination record, medical history, allergies, illnesses, height, weight, BMI, regular checkup dates, emergency contacts and doctor's details. Students can design a health card and discuss how it helps in emergencies and in tracking fitness. Question 7. Have a debate on are there ill effects of fast food on companion animals? Answer. Points in favor. Yes. Fast food contains excess salt, oil, sugar and spices harmful to pets. Causes obesity, digestive problems and reduced lifespan in animals. Pets need specially formulated food, not human fast food. Points against. No. Occasional small portions may not cause harm. Some pets may digest small amounts of certain fast foods. Conclusion. Regular feeding of fast food is harmful. Pets should be given nutritious diet suitable for their spices. So friends, we have completed all the question answers from chapter 3, Health, the Ultimate Treasure. We have already studied the short notes and summary of this chapter. You can find the link in the description and on the screen. If you like the video, kindly like, hype the video and share it with your friends. Also subscribe to my channel for more such videos. We will meet in the next video. Thank you for watching.